Hi everyone, my name is Darren Coggins. I want to talk to you today about some of my credentials for this channel and why I wanted to start the channel. So first off, I am currently a pharmacist in Ponca City, Oklahoma. I received my Doctor of Pharmacy degree from the University of Oklahoma in 2017. I have been working in the field of pharmacy for the past 13 years, first as a clerk, then a tech, then an intern, and now currently a pharmacist. The purpose of this channel is to educate the general population about the inner workings of their local pharmacy, and also to help current pharmacy students in any pharmacy topic that they are currently studying, or if they want to talk about non-pharmacy aspects such as life after pharmacy school, student loans, things of that nature. In today's video, I would like to talk about prior authorizations, so let's get started. Okay, so what is a prior authorization? A prior authorization is a form that is used by insurance companies to help the patient and the insurance companies save money. The purpose of this is to have the doctor choose a product on the insurance formulary to treat the same disease state for which the original prescription was indicated. So basically, the insurance doesn't want to pay for an expensive med if they think something else that's cheaper will work. So prior authorizations are supposedly to help the patient save money, which is true to an extent. However, PAs can delay patient care and in severe cases put patients at risk, but we'll explain that in a little bit. So here's the cycle of a prior authorization. A PA is generated by the pharmacy and then is sent to your doctor. The doctor then fills out that form and sends it off to the insurance company. Once the insurance company receives it, they review the form and they will either approve it or deny it. Here's where things can get a little tricky. Once the insurance company sends the approval or denial to the physician, they should send it to the pharmacy, but that doesn't always occur. So here's what would happen upon a prior authorization denial. So the doctor basically has three options if the prior authorization comes back denied. They can fill out the missing information and resend the PA form back to the insurance company. Sometimes the doctors leave off the quantity or day supply or diagnosis code is probably the most often thing missed. Once they resend that information, it usually gets approved pretty quickly, however. The doctor can also choose to prescribe a lower tier medication to avoid the PA. So the reason that the PA was issued is because the insurance company has a formulary list of approved medications they will pay for. If the doctor chooses to pick one of those medications, if they feel that it'll help the patient, then they'll just simply rewrite the prescription for one of those approved medications. Finally, this doesn't happen very often, but the doctor can inform the patient that the prior authorization was denied and that they're not going to do anything about it. I have received prescriptions that says we will not do a PA for this. It's unfortunate, but it does happen. Upon approval, it's a whole lot easier process though. Upon approval, the physician sends the approved paperwork to the pharmacy, and then the pharmacy resends the claim. Pharmacies can rerun claims through the PA approval process to see if it is approved before receiving the confirmation from the physician. So from the time that it's first initiated, the pharmacy can actually resend the claim if there's no confirmation sent to them, because 90% of the time we don't get that confirmation and we have to reprocess the claim to see if the PA was actually approved. But that can be done throughout the process, and we just basically try every day during this process to see if it's been ran through. If you want, the patient can request that the pharmacy call the doctor, or it's actually better if the patient calls the doctor to see if the PA has even been started. So here are some problems that I was talking about that can occur with prior authorizations. Delay in patient care is a big one. Like I said, paperwork's not filed out in a timely manner or filled out incorrectly. Approvals are not sent to the pharmacy, so it delays the patient's receiving the medication by a day or two, or the doctor just flat out refuses to complete a prior authorization. Suboptimal care can also occur if a patient has to try the lower tier medications before they can before the insurance will actually pay for the original prescription that was prescribed. So that's a lot of information, but there are some patients, or there is a patient role in prior authorizations. So the first thing a patient can do is ask the pharmacist if there's an alternative that they would recommend for their doctor to prescribe. Second, like I was saying earlier, a patient can always call the doctor regarding their prior authorization. It does speed it up. They don't want to hear from the pharmacist. They just want to hear, if they hear from the pharmacist and the patient, however, it seems to me that they get things done in a more timely manner. Finally, you can always pay cash to avoid prior authorizations. Although, like I say here, it is a last resort because a lot of the medications that require prior authorization do cost in the hundreds to thousands of dollars. So, in conclusion, prior authorizations are put in place to help the patient, but they can be a hindrance. There are things patients can do to help the process. And remember that the pharmacy staff is there to help you and should be willing to help with this process. Okay, so I know that was a lot of information, but I hope I was able to help explain what a prior authorization is, how it works, and how you and your pharmacist can get through the process. So what I want to do now is thank you for watching, and please feel free to comment if you have any questions, concerns, or need some clarification. Also, if you want to see more videos like this, please hit the subscribe button and I will try to get one every week. Thank you for watching. God bless.